Hello, and welcome to the CPC Certification Review Training with Legacy. This training is designed to assist you in passing the CPC certification exam. This course is not designed for beginners. You should have an understanding of the coding process prior to taking this review. ICD-10-CM will be covered by 5 questions on the exam, testing your proficiency in diagnosis for all the chapters included in ICD-10-CM, as well as thorough knowledge of the ICD-10-CM Official Guidelines for coding and reporting. Additionally, diagnosis questions will appear in other sections of the exam from the CPT categories. The International Classification of Diseases, 10th Revision, Clinical Modification, or ICD-10-CM, is a system used by healthcare providers to classify and code diagnoses for medical billing and research purposes. The ICD-10-CM is organized into chapters, each of which covers a specific category of disease or medical condition. The chapters are organized based on body systems or etiology. Each chapter is further divided into categories and subcategories that provide more detailed information about the specific disease or condition being coded. Each code in the ICD-10-CM consists of a letter followed by a series of numbers that provide information about the specific diagnosis, such as the location, severity, and cause of the disease. Overall, the layout of ICD-10 is designed to be comprehensive and specific, allowing healthcare providers to accurately code and classify diagnosis for billing and research purposes. On your screen now is a look at some of the layout of the ICD-10 that we will be reviewing today. ICD-10-CM Alphabetic Index to Diseases and Injuries is listed in an indented structure. Be very careful in looking at the alphabetic index to be sure you are selecting the correct code from the indentation format. See the example of history from the ICD-10 index. Note the difference between family history and personal history. The table of neoplasms is presented next. There are 7 columns in the table. The first column lists the body areas and is also presented in an indented format, just like the rest of ICD-10 index. The next columns describe the type of neoplasms. A primary malignancy is the site where the cancer originates. A secondary malignancy results from a metastasis and forms a new focus of malignancy elsewhere. Cancer will commonly metastasize to the lymph nodes, liver, lungs, or brain, but can metastasize to any location. This will be determined by the documentation. Cancer in situ describes a malignancy confined to the origin site without invading neighboring tissues. The neoplasm is encapsulated. Think of the yolk of an egg. Benign neoplasms do not contain precancerous or cancerous cells. They typically grow slowly and do not metastasize. Uncertain behavior indicates the pathologist is unable to determine whether it is benign or malignant. It has characteristics of both benign and malignant cells, and the pathologist is unable to determine. This column is only used based on the results of a pathology report. Unspecified indicates the provider cannot or has not determined the nature of the neoplasm. The next table in the index is the table of drugs and chemicals. This table is used to identify drugs and substances that cause poisonings and adverse effects, as well as when patients are not taking enough of their medication, which results in them remaining ill. All of the codes in this table will require a 7th character, and you should never code directly from the table of drugs and chemicals. Always verify the code in the tabular list. There are 7 columns in the table. The first column identifies the substance. Again, it follows an indentation format, just like the rest of the alphabetic index. There are 4 different types of poisoning in columns 2 through 5. A poisoning occurs when a drug is taken in the wrong dosage or is taken in error. It is also used for intoxication or poisoning by a drug or other chemical substance. These columns are discussed further in later chapters. An adverse effect is when a drug has been correctly prescribed and properly administered, but the patient had an adverse effect to the drug. The underdosing column is used to report when the patient takes less medication than is prescribed by a provider or manufacturer's instructions. Codes from this column are never assigned as a principal or first listed code. The next section is the external cause of injuries index. The external cause codes are used to describe how the injury occurred. If a patient has a broken arm from a fall, you can look in this index for fall, and it will have a list of types of falls. Without further information about the fall, W19 would be selected. The code is verified in the tabular list to assign the remaining characters for a complete code. The majority of the codes in this section will require 7th characters. Do not assign codes directly from this table. Always confirm the code in the tabular to confirm the correct 7th character. The notes at the beginning of the ICD-10-CM Chapter 20 in the tabular list define transport vehicles and explain the structure of the chapter. This will assist the coder in finding the correct external cause codes to report and will be discussed further in later chapters. External cause codes are never primary and always follow another code. At the front of the ICD-10-CM, the conventions for ICD-10-CM and the official guidelines for coding and reporting are found. The conventions and guidelines instruct coders in how to read the book and how to properly report and sequence diagnosis codes. Time should be taken to review both conventions and the guidelines. Section 1.A lists the conventions for the ICD-10-CM. Section 1B lists the general coding guidelines and instructions on basic knowledge of using the ICD-10-CM, such as multiple coding for a condition, combination codes, acute versus chronic conditions, signs and symptoms versus diagnosis. The ICD-10-CM official guidelines for coding and reporting can be found at the beginning of your ICD-10 book. Section 1A talks about conventions, general coding guidance, and chapter-specific guidelines. An example of an instruction found in the coding conventions is the use of the abbreviation NOS. NOS means not otherwise specified. This is the equivalent of unspecified. Using this code means that you do not have enough information for a more specific diagnosis. Parentheses are used in both the alphabetic index and the tabular list to enclose supplementary words that may be present or absent in the statement of a disease or procedure without affecting the code number to which it is assigned. The terms within the parentheses are referred to as non-essential modifiers. The non-essential modifiers in the alphabetic index to diseases apply to subterms following a main term, except when a non-essential modifier and a subentry are mutually exclusive. The subentry takes precedent. For example, in the ICD-10-CM alphabetic index under the main term enteritis, acute is a non-essential modifier and chronic is a subentry. In this case, the non-essential modifier acute does not apply to the subentry chronic. In this example, if the provider states the patient had diabetes and stage 5 chronic kidney disease, it is presumed diabetes and chronic kidney disease have a causal relationship and would be coded with E11.22 type 2 diabetes mellitus with a diabetic chronic kidney disease. Looking up that code in the tabular list, you'll find a use additional code notation to identify the stage of chronic kidney disease. We add another code for N18.5, chronic kidney disease, stage 5. Section 1C lists the chapter-specific guidelines, and this is one of the most important sections in your book. It is important to understand how to find the reference guideline and how to interpret the guideline for correct reporting or sequencing. In this slide, it is a reference on how to find Section 1C 4A2. To find the guideline referenced, we would first open our ICD-10 book from the AAPC year 2023 to page G3 in the beginning. We would note here that we are in Section 1 for Conventions, General Coding Guidelines, and Chapter-Specific Guidelines. We would then turn our book to page G13 to find our chapter-specific guideline for endocrine, nutritional, and metabolic disease. From here, we would find indentation for A for diabetes mellitus, and then we would reference further down to 2 for the types of diabetes mellitus not documented. Furthermore, on G13, there is a figure at the top right of the page that will help us understand more on how to report this guideline. Regarding coding structure, codes can be as short as 3 characters or as long as 4, 5, 6, or 7 characters in length. The coding structure is important because the additional 4th, 5th, 6th, and sometimes 7th characters help further define the condition. For example, in diabetes, the 5th or 6th character represents the most accurate level of specificity. For example, E11-610 is type 2 diabetes mellitus with diabetic neuropathic arthropathy. Some codes require a 7th character to complete them. Some codes will require placeholder X to make the code long enough for the 7th character to be reported in the 7th position. Look at code T16.1, which is a foreign body in the right ear. There are no further divisions of T16.1. Adding 2 X places to the end of the code makes the code long enough for the 7th character A is correctly positioned in the 7th spot. The 7th character A represents an initial encounter. In order to locate the proper diagnosis in the ICD-10-CM, we'll first want to find the documented diagnosis. After such, we will look up the main term in the Alphabetic Index to Diseases and Injuries. We will find the code in the tabular list and then review all the conventions and notes associated with the code in order to assure ourselves that we are using the right code. In order to determine the main term, we need to review the medical record and be asking the following questions. What is the disease? What is the illness? What are the symptoms? If the documentation stated the patient had acute bronchitis, the main term we would look up is bronchitis. Let's try to determine the main term in these diagnostic statements. Ruptured ovarian cyst. The main term here would be cyst. Abdominal pain. The main term here would be pain. Chronic sinusitis. Well, the main term here is sinusitis. Going back to our example of bronchitis, if we were to look up bronchitis in the alphabetic index, we would see here the parentheses, which we learned earlier were the non-essential modifiers, followed by indentations, leading us to a more accurate and highly specified coding selection. Because our documentation stated it was acute bronchitis, we would go from bronchitis and look indented to acute or subacute, and that would lead us to the correct code of J20.9, which we would then confirm in the tabular list. Note the includes, excludes 1, and excludes 2 notes associated with the category J20. The includes notes give examples of the codes or content in the category. The excludes 1 notes are pure exclusion notes. Excludes 1 means not coded here and happens when 2 codes cannot exist or occur together. Excludes 2 is slightly different. Excludes 2 means not included here. The patient may have both conditions at the same time. After you've located the proper ICD-10 code, be sure to read all the notes associated with the code. the includes, excludes 1, excludes 2, and any governing guidelines. Thank you for joining us for this review. If you would like more details about our intensive CPC training or any of our other training programs, please visit our website at medicalbillco.com.